Hi there, this is Dr. Evan Osar with the Integrative Movement Institute. Thank you so much for joining us today on Facebook Live. And in this past week's episode, we were discussing the forward head posture because so many of your older clients, especially now in quarantines, and now here we are 10 months into it, and from what I'm hearing, there's really no end in sight. So whether you are for it or against it, the reality is it's going to be here for a while, a long while. So the important concept here is, or the thing I want you to take home from this is that we have older clients that are in their house. They're not leaving their house. They're not interacting with people. They're not exercising. They're not getting enough physical activity. Their health is declining. My good friend Robert Linkle and I, who just did 2 weekends ago, we did the arthritis training solution. We talked about this. We talked about how the health of our older client was already, our population, that population was already, their health was declining rapidly. Now think about it. Now they're not out and about. They're not going to church. They're not going to the store. They're not going to their social outings. They're not going to the gym. And many of them are just sitting at home. They're waiting and they're hoping that things will get better. And you know what happens when you sit around and just hope things will get better. It generally doesn't turn out so well. So that's why it's so important that you understand this information, and more importantly, that you're able to share it with your clients in a way that educates them, enrolls them, and most importantly, empowers them to take action, because there's so much we can do for our older clients. And I just want to share a quick story about my client, Debbie. Debbie came to me right before, I mean, she's been a patient of mine for a while, but right before quarantine, we were working with her head and neck issues because she again, very typical of older adults, she had the forward head posture. And it impacted her to the point where she was losing her balance. Like she'd be walking, she's like, Dr. Osar, when I'm walking, I turn my head and I'll go to look over my shoulder and then I trip and fall. And I ended up sending her to a quote-unquote dizzy specialist. That's his term. He's like, I'm a dizzy specialist. And what he determined was, after he did a course of tests, I put her through my assessments, and then I'm like, okay, this is beyond what I can do with you. So I sent her to this specialist, and he's like, wow, it's coming from her cervical spine. It's coming from her neck. She's got osteoarthritis in her neck, spinal stenosis in her neck, and she also has this condition, and again, don't get hung up on the name here, spondylolisthesis, where vertebrae are actually shifting on one another. Now that's very common, and you don't know that unless you have a client that's gone through a motion X-ray, where they can actually look at the neck and watch your neck move, or view the vertebrae of your neck when you're moving. And I took her to a specialist, I should say a doctor in the area, who actually had a motion X-ray machine, because not too many people have them. And we could see on the X-ray, the actual, when she bent her head forward, it almost looked like, instead of the vertebrae being on top of each other, they actually just slipped right off. It was crazy to see, because theoretically, I knew what spondylolisthesis was, but I'd never seen it actually happen in someone. So it's really cool to see it, and also quite frightening when you think about the spinal cord and the nerves coming out. So a lot of your older clients have that. Actually, a lot of your younger clients, if they've had whiplash, head and neck trauma, they've got these issues. And now we got more people sitting with that forward head, whether they're on their phones, their tablets, they're watching TV. I mean, we've got a huge issue ahead of us. However, with that challenge, we also have a great opportunity. You have a great opportunity to get this information out to your clients and really empower them. Enroll them. You don't have to, if your clients can't afford it or they don't like it, enroll them in some free education. Just give them like 2 to 3 minute sort of segments about the importance of posture and simple, easy things they can do. So, talking about posture, there's a common rehab exercise to help and address the forward head. And if you're on our Instagram page, IIHFE, yesterday my buddy was making fun of me. He's like, dude, that's gold. What you did on there is gold. For all you true Seinfeld fans, you'll get that reference. But in it, I walk out and I'm like this, and then I'm doing a traditional rehab exercise like that, which is supposed to fix the forward head, train the deep neck flexors, and even help disc problems. Unfortunately, it doesn't the way most people are performing it. And there's a lot of lazy therapists and lazy doctors that are just randomly giving people that exercise and don't really understand what the exercise is trying to do and more importantly, how to instruct their client to do it optimally. Now let's just talk real quickly about the deep neck flexors, because that's what the exercise is supposed to be addressing. The deep neck flexors, so here's your SCM. So put your hands on your neck right here. That's your SCM. The two SCMs are coming from your mastoid process down to your collarbone and your sternum. You peel that off. Now you get your scalenes. Your scalenes are very important breathing muscles. They also move the neck, stabilize the neck as well, but they're really breathing muscles. Okay? Now you take those muscles off, and now you get to your deep neck flexors. So longus coli, longus capiti. Coli means cervical spine. Capitis, longus capitis. Capitis means skull. Muscles that attach from the cervical spine to the skull, or muscles that just attach to the front side of the cervical spine. Now, what these muscles do, and this is why it's important you understand functional anatomy, not just what they do. Because yes, they will flex the neck like this, somewhat, not really, but they will assist that. But what their job, their primary role is, and this is why it's important to understand functional anatomy, not just structural anatomy, okay? What their job or the responsibility is their job is to maintain that cervical lordosis, so that curve of the neck. Their job is not to flex the neck, even though they can assist that motion. Their job is to maintain that cervical lordotic position. Their job is also all deep muscles. Their primary responsibility is to send signals back to the central nervous system about position or posture, about movement, what's happening as the joints are moving, and also the amount of load, the amount of compressive load, the amount of the speed of the movement, so that way your brain can interpret that information and then send out the most appropriate responses. What happens, however, and this is going back to the research of Gwendolyn Joel. I saw her probably 15 years ago. She was presenting this information, maybe even earlier than that, longer ago than that. She talked about how people have had chronic whiplash accidents. So let's think about this. Have you had a whiplash accident? And how many times have you had a whiplash accident? Whether it be in sports, whether it be in, just playing around, as kids, or maybe physically whiplash. What happens is these deep muscles, these deep neck flexors, for example, and this happens everywhere in the body, they tend to become inhibited. The superficial muscles become overactive. The way you train the deep neck flexors is not by doing crazy motions like that, fast and high intense motions like that. Because what that's doing is keeps perpetuating and training the bigger, the stronger, the superficial muscles. It doesn't train the deep neck flexors. And the more you do this with me, because again, I want you to understand, and more importantly, I want to prove to you everything I say, not just say it and say, oh, those people are wrong, I'm right. No, it's not about that at all. It's just like, is this right or is it not right? Or appropriate and not appropriate. Put your fingers on the back of your neck right here. So feel your spinous processes. Now do what you've been taught to do in rehab or you've seen on the internet. You just jam your head and neck back. And what happens? What happens to that curve in your neck? You reverse that curve in your neck. And now I want to ask you, you should have a cervical lordosis, so it's curved like this. Why would you want to train to reduce that curve? So you may be saying, hey, Dr. Osar, but what about all those clients that have an increased curve? Now I want to ask you, do you really think that exercise is helping get them back to optimal alignment? So they're like this. Do it with me now. Go into the posture that your older clients are in. Increase kyphosis, forward head posture. Now do that exercise. How awesome does that feel? It feels awesome, doesn't it? It doesn't feel awesome at all, right? It feels awful because you're jamming the joints together. And in fact, if your client has a hypermobile area of their neck, and they do if they're in this posture, they do. There's a hypermobile area there somewhere. All they're doing is jamming that hypermobile area. And if they have spondylolisthesis, which you don't know about unless you've had a motion x-ray, but you can pretty much assume many of your older clients do, you're going to keep hypermobilizing that area and perpetuate the problem, not help the problem. Now, you're like, okay, that's awesome, Dr. So now I feel awful, and I'm going to quit being a fitness professional. No. Here's why this is so important. And here's why I'm glad you're here. To optimally train the deep neck flexors, you need to help your clients go longer. Longer means that way longer. Not this way. That's not longer. That's shorter in the back and longer in the front. That's not any better than this right here. In fact, it's actually worse for your neck, okay? What we need to do is just do a quick, easy assessment because you don't want to guess. If you're not assessing, you're guessing, and that's what a lot of our industry is doing. And the thing that differentiates you as a specialist from everybody else that's out there is your ability to use a process that begins and ends with assessment. So a quick, easy assessment to do, and this is super easy to do, you can do this whether you're training virtually or in person, is just have your client stand with their feet together, hands by their side, and just looking straight ahead, and then have them look down as if they're going to look at the floor. So just look down at the floor, and you watch how they perform that motion. If you do this properly, and don't instruct them how to do it, just watch what they do, have them do this several times, is what you should see happen, is not what I just did, is you should see them go into deep neck flexion and then slowly roll their neck down and then look down. That's not likely what you're going to see happen. What you're going to see is probably what you saw me do, what you saw me do. You saw me just go boom and then down. And if your clients are already out here, it goes further forward and further down. And then they have to use their whole body because they don't actually have deep neck flexion. So here's a quick, easy way to start to train that process. And you can see me do this if you watch my Facebook Live and or my YouTube videos or my Instagram videos. You always see me do this. So what you want to do is cue your client. You can easily see my EOP, this bone right here. So again, it's basically halfway, it's in between, halfway, right down the midline of your skull. You want to feel as if you're getting pulled up there from the backside of your head and neck. Okay? That's what going along means. And it's not the chest. The chest and rib cage, the rib cage will follow the head once you get that up there where it belongs, relatively. Again, remember your older clients, they'll change this much, but this much of a change can create big changes in your clients. So long spine. Now, what you want to train them to do is to be able to gently tuck their chin, because the one thing about training deep stabilizers, anywhere in the body, whether you're core stabilizers, shoulder stabilizers, ankle foot stabilizers, is it must be slow, it must be controlled, and you have to make sure you're not overusing or actually even using significantly the superficial muscles. And that's why this exercise is so ridiculous for improving the neck. So what you want to do is go long and then very gently teach your client to just gently move your eyes down and your chin down as if you're nodding yes. And just do that a couple times. Just nod yes. And then you put your hands on the front side of your neck and make sure you can do that without jamming your neck, without losing your voice, and without feeling significant activity of these superficial muscles. You have them do a couple sets of 5 repetitions, three sets of 5 repetitions, several times a day. Incorporate that with the breathing. You get better activation of the neck flexors. You help get them better aligned. You change and improve their posture. You change and improve their vision, their sight vision, or I should say their vision, their sight, so that way they can actually start to train their eye muscles more appropriately. You change proprioceptive input into the central nervous system, and that's how you become a specialist. That's how you help clients with chronic neck issues. And of course, then you need to incorporate this into the appropriate exercises. So that way you know how to progress your client, how to train them to make sure that they're maintaining activity of the deep neck flexors, and also coordinating it with the superficial muscles. Because the superficial muscles do have to work if you're doing carries or rows or other exercises for everyday life. And again, that's how you become a specialist. So if you want to learn more, if you like this information, you want to learn more, join us for Two Anatomy Geeks. This brand new 3-part series of TAG, we're going to cover why so many of your clients have issues, why so many clients have deep neck flexor issues and overactive superficial muscles. And we discuss one common reason why here, chronic whiplash or head and neck trauma. We'll also talk about developing yourself into a specialist, because our goal is to help you become that specialist for your current clients and help you attract more individuals, especially those older folks that need you more than ever now, to help them stay active, to help keep them empowered when they're just in isolation by themselves oftentimes, to help give them strategies to maintain their health. Because I shared with you the story of my client Joel, who at 85, just turned 85 on New Year's Eve. Amazing individual. He's in better shape now since quarantine than he was before when I was going to his house and working with him one-on-one. It's all virtual. He's in better shape now. His balance, his strength, everything is better now because of some of these things that we've been instituting, and we've actually been able to do it and his wife is helping him do it as well. So it's really, really a great testament to this work, and that it doesn't matter what age your client is, just help them progress even a little bit. It can make exponential changes in their posture, their movement, how they feel, and give them that confidence to keep going on their positive health track. So, hope you enjoyed this. This is Dr. Evan Osar with Integrative Movement Institute. Mary will put this link for Two Anatomy Geeks if you're looking to learn more. It's really a fun way. Jill, my second of the Two Anatomy Geeks, she makes anatomy, learning anatomy really fun and practical. She shows you on George, her little skeleton. She shows you on herself. She shows you how to palpate on yourself so you actually feel how these muscles are working. We will take you through the assessments. How do you assess these muscles? How do you use the most appropriate corrective and functional exercises? And why some of the things we learn, all of us have learned, myself included, why some of what we learn isn't correct, and how to make better decisions about the exercises you use and or don't use with your older clients, especially your older clients. So, Mary will put the link in next to this video. If you have any questions, comments, put them next to the link. If you feel like this information is good and will serve your colleagues, like-minded colleagues, feel free to put that next to or in the chat box as well. I just want to leave you with my favorite quote from Dr. Martin Luther King Jr. And obviously yesterday was his day. And there's a lot of people out there that are misinterpreting what Martin Luther King's message was. And I put this message on my mirror so I remember to be more like him every day. And here's how the quote goes. It said, "Use me, God. Show me how to take who I am, who I can be, and what I can do, and use it for a purpose greater than myself." And I look at that and I think about it every single day. Because when I get upset with what's happening in the world, when I get upset with other people and things they post and things they say, I know I'm not being used for the purpose that God put me here. And I want to look to Him. I want to look to other great people like Immaculate Ilogiza, who survived the Rwandan genocide. And when people asked her, "How did you survive?" she's like, "I prayed to God." When people were standing outside her room, she was hidden in a room by this Hutu priest, the tribe that was killing all the Tutsis. She was hidden in this closet for 3 months with 7 other women. She survived, and she thanked God. She said, "I prayed to God every single day and most of the day that she survived." And she survived when millions were killed. I want to be more like these people. I want to be used by God to bring a positive message to you, so that way you also feel empowered to go out there and share that message with your clients. So as we think about Martin Luther King, Dr. Martin Luther King, and his legacy, to me, that's his greatest legacy. He didn't talk about taking what's not yours. He didn't talk about violent protests and riots. In fact, he actually followed Mahatma Gandhi's approach of nonviolent protests. So every day, I want to be thankful for the great leaders that have come before us and left us with great messages, and to be used, right? To be used for a purpose greater than myself. So thank you for allowing me to share that. Thank you for all you do for your community, for your family, for those around you, making this world a better place. We can change the world. Go out there and let's do it together. Thanks so much for watching. We'll see you next time. This is Dr. Evan Osar.